to get into a virtual space, different opinions from different disciplines across the country, and be able to formulate a treatment plan for patients virtually, I think is where we're heading in medicine.
The idea of PrecisCa had been in my mind for many years. When the pandemic propelled us onto telehealth platforms, a friend of mine who went to high school with me expressed a desire to do something in healthcare, and I presented him with this idea of getting complex cases to expert faculty on a Zoom platform and get their input in a multidisciplinary, multi-institutional level. We are very proud to have an internationally acclaimed faculty from top-notch institutions, and we can turn around a second opinion in 4 to 9 business days, which is in line with what would happen at a hospital or a major institution for their weekly tumor boards. And we also have these cases anonymized so that they can end up in our virtual library, where we also have lecturettes on 5 to 7 minute hot topics. And that's the major asset that we have for education and for raising the level of cancer care around the world. In addition, we do 2 live meetings a year starting next year. They've been very well received, thanks to our sponsors who have asked us to increase the cadence of those meetings. And our sponsors in the industry can use our educational tools to educate their MSLs and their representatives. In addition, oncology nursing societies, Oncology Nurse Practitioner Society, JADPRO, and training programs for fellows can use our content. We also do virtual meetings, advisory boards, product theaters, and we have the capability of making customized content upon request, because our faculty are very available to us.
Dr. Sylvan, she introduced you guys to me. She told us about the website. I went to the website, I looked at many of the videos and many of the bios, and I was like, man, this is pretty awesome that you have, all of these people with all of this background, and some looking younger and then some looking seasoned. So it looked like you had a well-rounded, if that makes sense, group to be able to evaluate cases and things of that nature and get different perspective. Then it allowed me to have information so that I could go back and ask the doctors questions that me in my limited knowledge would not have been able to ask if I didn't have resources that would help me to develop those questions so that they could be answered in a timely fashion in a way that would help the treatment that I was receiving to be better.
Most of us recognize that it's very hard to get a multidisciplinary tumor board together. We want to kind of improve access across the country and make them available so that, the cases may not match up perfectly with the patient in front of them, but they can at least see the thinking process of how we go through it.
This is great that you have it out there, and if somebody can sit down and search and find a network of doctors who can look at your case and give you a second opinion on how you're being treated, that's just phenomenal.
Building a foundation of what we're going to be doing in medicine for a long time.
The mission is simply to raise the level of cancer care around the world.
And we are PrecisCa.